Doc, starting.
Mr. Rajdeep is not ready as yet.
That's okay. He will join in. Not a problem.
He's gone off screen. So
Sorry?
he's gone off screen. So he has to.
Tips for saving the feet of people with diabetes. And it's our proud privilege to have Dr. Vijay Viswanathan and Dr. Vishnu Priya with us today. And we are going to be joined by Mr. Rajdeep Sardesai. So I will outline in brief how the program runs. I will give a brief introduction of South India Mice Association, SIMA for short, after which I will introduce, after which I shall give a brief introduction to about Rajdeep, and then hand over to Dr. Vishnu Priya, who will run through, and after which Rajdeep will take over for the interview with Dr. Vijay Viswanathan. So to give a brief outline on what South India Mice Association is. SIMA, or South India Mice Association, was founded by a group of like-minded individuals who are eminent professionals in the trade of hospitality, events, travel, airlines, conferencing, exhibitions, and logistics. MICE requires a proper trust in South India and needs to be represented by facilitating services in organizing meetings, conferences, incentives, and exhibitions. That is the expansion of MICE. We also, that is SIMA, also represent the trade to the government to promote the region as a favorable MICE destination. Region meaning South India.
Hi, Doc. Good evening. Good evening, Doctor.
Hi, Shabin. Just start. Thank you. That is our president of South India Mice Association, Mr. Shabin Sarvotam.
Hi.
Shabin, I was just introducing them to SIMA.
Okay.
So, welcome, Shabin.
Thank you.
We also have the colleagues, our founder members of SIMA with us in this exhibition hall and the conference hall here. So SIMA also represents the trade to the government to promote the region as a favorable MICE destination. SIMA plans to be South India's leading association to effectively promote and manage with integrity, ethics, and transparency as a non-profit association. SIMA endures to facilitate all stakeholders in setting the benchmark through effective planning, resource management, and execution of every event. Our expertise is delivery on time, dedicated work ethics, and rich experience, and which positions SIMA among the best in the industry. You can contact us at info@thesima.in. You can also visit us at our website, thesima.in. Now, the main person who is going to be interviewing Dr. Vijay Viswanathan is Mr. Rajdeep Sardesai, who is quite well known in India. Rajdeep is an award-winning senior journalist, author, and TV news presenter. His latest book, 2019, How Modi Won India, is a national bestseller, as was his previous book, 2014, The Election That Changed India, which has been translated into half a dozen languages. Currently, Rajdeep is the consulting editor and lead news anchor of the India Today group and has over 3 decades of journalistic experience in print and television. Rajdeep was the founder editor of the IBN 18 network, which includes CNN IBN, IBN 7, and IBN Lokmat. Prior to that, he was managing editor of both NDTV 24/7 and NDTV India, and was responsible for overseeing the news policy for both the channels. Rajdeep has also worked with the Times of India for 6 years and was city editor of its Mumbai edition at the age of 26. During his long career in journalism, Rajdeep has covered major national and international stories, specializing in national politics. Rajdeep has won more than 50 awards for journalistic excellence, including the prestigious Padma Shri for journalism in 2008, the International Broadcasters Award for coverage of the 2002 Gujarat riots, the Ramnath Goenka Excellence in Journalism Award in 2007, and the 2019 Prem Bhatia Award for Political Journalism for analysis of the 2019 elections. He is the first Indian to win the Asian Television Award for both talk show and news presentation, and has been the news anchor of the year at the Indian Television Academy a record 10 times. In 2020, he was conferred with Lifetime Achievement Award at the annual News Broadcasting Awards. Rajdeep has also been the president of the Editors Guild of India and was also chosen as a global leader for tomorrow by the World Economic Forum. Rajdeep has his own blog site and is the third most followed journalist in the world on the social media site Twitter with 9.1 million followers. So with that, I would like to welcome all the panelists here, Rajdeep and Dr. Vijay Viswanathan and Dr. Vishnupriya, as well as the president of SAIMA, Mr. Sabin Sharvotam, and hand over to Dr. Vishnupriya. Kindly take over, Dr. Vishnupriya.
Thank you. So before I introduce Dr. Vijay Viswanathan, we would like to pay our homage to our founder, Professor M. Viswanathan.
Can you have the next slide? So Dr. Viswanathan established the MV Hospital for Diabetes in 1954, and he has the credit of starting India's first organized diabetes clinic in India in 1948 in the government Stanley Medical College and Hospital. And he was also serving the same medical college till 1971. And he has many unique contributions to his credit. He was the president of the Diabetic Association of India. He held the first National Congress on Diabetes in India in 1969. And he was the president of the Research Society for Study of Diabetes in 1977-79. And he was probably the first president from Tamil Nadu in the Association of Friends of India. His main contribution was diet to Indian diabetics, and he showed that a person with diabetes can eat rice, and he did a lot of studies to prove that point. And he was the first diabetologist who said you can take rice and you need not just take wheat. So that was the introduction about Dr. Viswanathan, Professor Viswanathan, and I think we wanted to pay a small homage to him before we start.
So it's an honor for me to introduce Dr. Vijay Viswanathan, the head and chief diabetologist of MD Hospital for Diabetes, and Professor M. Viswanathan, Diabetes Research Center, Roypuram, Chennai. It's a privilege for me to introduce him as I'm one of the thousands of doctors trained by him. It is impossible to mention his every single accomplishment because there are many. So let me share some. He has been practicing diabetology for the past 30 years and devotes equal amount of time for research, and that makes him unique and resourceful. He is the first Indian to have a PhD for studying the connection between diabetes and kidney in 1994. He has been a keen researcher and has built a research team at Professor M. Viswanathan Diabetes Research Center. The team has published over 200 original research papers in various areas in diabetes in peer-reviewed and well-known research journals. He has the unique honor of being invited to write a commentary in the prestigious journals like Lancet, Diabetology, and Nature Reviews. Dr. Vijay Viswanathan is the first recipient of the Vivian Fonseca Scholar Award by American Diabetes Association for his work on diabetes and tuberculosis. He has trained over 2,000 doctors in diabetic foot care from India, Bangladesh, Nepal, and Sri Lanka. He has set up an exclusive state-of-the-art diabetes hospital and diabetic foot clinic in Chennai with a multidisciplinary team of doctors and staff. He is currently the National Vice President of the main diabetes organization of India called the RSSDI, that is the Research Society for Study of Diabetes in India. It's an honor for India that he was elected by diabetic foot experts from 80 countries as the first non-European president of D-Foot International, which is based in Belgium. And today, he is here to talk about tips for saving the feet of people with diabetes. Over to Mr. Rajdeep Sardesai to start the program.
Rajdeep, please come in. Hello.
Yeah.
Rajdeep, welcome.
Yes. Thank you very much, Ajit and Saima for having me here. Just give me half a second while we just get this right. Thank you so very much for having me at this prestigious occasion. First of all, Dr. Viswanathan, to you, congratulations. It is indeed a great honor for this country, for your family, and indeed for the community of doctors that you are the first Indian to be elected as the president of D-Foot International, in fact, the first non-European. And therefore, before anything else, I want you to tell us a bit about D-Foot International and about this rare honor, doctor, that has been bestowed on you. Give us, the listeners who are watching this, a sense of what this means.
Thank you, Mr. Rajdeep Sardesai. I think the D-Foot International represents the diabetic foot experts from across the world. It's one of the largest or the largest association for diabetic foot experts from the world. And the first president, in 2017 it was formed. The first president was from Belgium. The second president was from Spain, Madrid. And the third, they elected me. And it was election, and people from 80 countries voted for me in a place called Hague in Netherlands. And I was the president-elect for 2 years, and from 2021 until 2023, I have been asked to become the president for this organization, which has got 7 regions. The 7 regions are North America and Caribbean, South America, Central America, Middle East, and going up to Western Pacific and Southeast Asia and so on. So the main objective of this organization, or I should say the flagship project, is the Train the Foot, Train the program. So what we do is we train the doctors, the diabetic foot experts, and they in turn will train others. So we take a country and we train, say, some 40 doctors, and they in turn will train 4,000 doctors. So that will result in improvement of the quality of diabetic foot service, which everybody provides. Our ultimate aim is to prevent a lower limb amputation due to diabetes worldwide. That's our main mission. We do not want anybody to lose their leg due to diabetes. If they lose their leg due to some bomb blast or road accident, it's okay. But due to diabetes, nobody should lose a leg. So that's our main mission. And I'm happy to represent India. And I would say I was fortunate enough to be elected after 2 Europeans. And this is completely based in Belgium. This organization is headquartered in Belgium. And it was an honor that they elected me. I stood for election. I never thought I'll win because there was a German and a Brazilian person also standing with me. So I never thought I'll win the election, but they voted for me. So thank you, Mr. Rajdeep, for this introduction and joining us today.
Dr. Viswanathan, at the start, we had the introduction to your father. I'm sure your father would be a very proud man that his son has become the first non-European president of DFood International. It is a rare honor, and you're right. To do it in an elected manner makes it even more special. So clearly, you had a lot of people who supported you. And as I said, it's an honor for India and for the doctor community. Just give me a sense, though, Dr. Viswanathan, because, India is known as the diabetes capital of the world. But DFood, the fact that you're saying you're linking the issue of diabetes to the concerns.
Recording in progress.
To people lower limbs, particularly the concern you mentioned about amputation. Give us a sense. Why is it, so far we know India is the diabetes capital. Give us a greater sense about DFood.
So we know that people in India have a very high chance of getting diabetes due to two main reasons, which is a big burden for the country. One is we Indians are supposed to have a lower muscle mass compared to the Europeans. So that condition is called sarcopenia. And we Indians are supposed to have more fat inside our body. So we Indians are called the thin fat Indians because we are very thin as far as the muscle mass is concerned, but we are very fat because we have a lot of fat inside our body. So this makes us uniquely prone to get diabetes. Now, when you get diabetes, it goes on for several years unnoticed, and it affects the nerves, the kidneys and eyes before you can realize it. So what happens now, our discussion is with particular reference to the feet. So what happens in diabetes, which goes on for a long time unrecognized, because it's quite a silent disorder. What happens, the people start losing sensation in their feet. So they have a condition, they develop a condition called diabetic neuropathy. Neuropathy, pati means disease in Italian. So in Latin, I mean. So it is neuropathy which happens. Now, about 70% of people who develop amputation in India do undergo amputation because of neuropathy, which is a very sad thing because neuropathy is a condition where sensation is gone and you step on something which is hot or something which is sharp and it hurts you. And it doesn't give you any pain for 2-3 days. The leg gets infected, the foot gets infected, and you present very late to the surgeon or the physician. By the time the infection has spread up to the knee and the surgeon is forced to cut off the leg. So it's a pity that in India and in many other countries, most of the amputations which happen are avoidable and are due to neuropathy, loss of sensation. So that's why it's very important organizations like DFood teaches doctors how to examine the feet and present to the doctor as soon as some injury happens to the feet and not delay it because you won't have pain. It is said pain is God's gift to mankind. That pain sensation is removed in people with diabetes.
Let me get that again right. You gave me a figure just now. 70% of those who have to go through amputations in this country are linked to neuropathy, linked to diabetes. Is that what you're saying? That therefore the diabetic patient in India would be far more prone to having these kind of this pain in the leg, which could lead to amputation. Am I correct?
Yeah. So what I meant was 70% of the amputations which happen among people with diabetes in India is due to neuropathy. So neuropathy is the commonest cause for a leg being removed for a person with diabetes in India. Yeah.
So are we saying that therefore someone who has high diabetes also runs a high risk in a way of being affected, where their limbs would be affected due to lower limb amputation?
Yeah. So when you have high blood sugar for say 3 years or 5 years, it affects the nerves, it affects the retina, the kidney, so many other organs. But again, our reference today is with respect to the feet. So what happens is the people with diabetes with high blood sugar, uncontrolled diabetes, will lose sensation in their feet, and immediately they will not get an infection. But when they stamp on some sharp object and some hot object in a temple or whatever, when they walk barefoot, then that will lead to infection. And if the sugar is not under control at that point of time, it will flare up and it will produce a massive infection which no doctor can treat.
That in a way is alarming, is worrying. It in a way sort of also emphasizes the need to sort of control diabetes, control your blood sugar. But in a low resource country like India, doctor, how do you manage this? Because presumably the process of amputation is expensive. Can people actually be able to afford? Is it affordable? If I, God forbid, I'm in that position in this country?
Yeah, so that's exactly what I did in the last 30 years. So when I entered practice in 1991, 30 years ago, I found a lot of people undergoing amputation. And I knew from my heart and from my conscience that we can prevent amputation in many of them. So what I did was I did intensive research for trying to find out the risk factors for neuropathy and for diabetic foot infection. And I tried to develop our own footwear, which was not available at that point of time in India. So it is definitely possible in a low resource setting like India or Indonesia or Brazil to prevent an amputation if you take care of diabetes and if you give proper care to the feet. You don't need to be in Germany or London to take care of the feet. Even we know how to take care of feet. So the doctors must be trained to teach their patients, that other doctors, to take care of the feet and to recognize the early signs of some injury and disaster which is happening.
Can you give us a sense of this footwear? Expand on this unique concept that you've developed, doctor, in a way, because I haven't heard of this before. So maybe this is something that you and MB Hospital in a way have patented, or the kind of footwear that you're putting out. Give us a sense of it.
So what happens, Rajdeep, is when you lose sensation in the feet, it's not the sensory nerves alone. The muscles in the foot, they get affected. So you get a deformity of the feet. The toes will become bent. So the people with diabetes who have this condition called neuropathy should not be wearing the famous Hawaii chappals, which most of our people wear because it's very cheap. But if they wear the Hawaii chappal, which is very cheap, you will find that as they walk, the footwear will be behind them and they will be in front. It will fall off. It will slip out of their foot because the muscles are not able to hold on to the footwear. So we developed, along with Central Leather Research Institute, which is in Chennai, and the Central Footwear Technical Institute, which is also in Chennai. We collaborated with them, looked at newer materials like the EVA sole, PU foam, and we started developing footwear which is made of these materials. And about 70% of people with diabetes do not require what is called a customized footwear. They need only a good fitting footwear, which is meant for their feet, which will take care of the neuropathy and so on. About 30% who have clawing of the toes and deformity need a customized insole. Like example I'd like to give you is you can stitch a shirt by going to a tailor, by giving him the cloth, which is customized. Whereas you can buy a ready-made shirt if which size fits you. Like that, the footwear can be ready-made in 70% of people. You can buy designer footwear which we're making. But in 30% who have clawing of the toes and all that, you can't get ready-made shoes or sandals. You have to make them customized. It's customized to that patient. So that is where we have excelled in the last 3 decades. We have provided the footwear, designer footwear for people 70% who just need a good proper footwear vis-a-vis the Hawaii chapel, and also cater to the 30% who require specialized insoles, specialized customized insoles and footwear.
So what you're telling me is that if there is someone out there with neuropathy who runs the risk of amputation, as a first step, would you provide them this specialized footwear
Yeah.
to try and give them the possibility that they will be able to overcome their without necessarily having to go through amputation? Am I correct?
Yeah, exactly. So 2 points. One is we teach them not to walk barefoot. Even if they're going to a temple, they should wear a socks. We have manufactured what is called temple socks, which they can wear when going to a temple. They should not walk barefoot inside a temple or inside a puja room. Second point is, if you have neuropathy and diabetes, already established neuropathy, and if you don't have deformities like clawing, you can give them the designer footwear which we have made. Or if they have a deformity, if they already had an amputation with one toe which is missing, then they should go for the customized insole. Yeah, so practically everybody with diabetes should wear a good footwear. Yeah, that's the bottom line.
There's a lot of interest in what you're saying. Someone is just sending me a message and saying that can doctor translate this into Hindi for us? Can we have this is being asked by a gentleman here, Push Rawal is asking, can you translate to Hindi? I will just try to put it briefly. Doctor कह रहे हैं कि उनके पास अगर आपको डायबिटीज हुआ है, न्यूरोपैथी हुई है, तो उन्होंने एक स्पेशलाइज्ड फुटवेयर तैयार किया है, जिससे कस्टमाइज्ड फुटवेयर जो एक तरह से आपके पैर को बचा सकता है, और ये अपने आप में बहुत बड़ी बात है. Is there anybody else in India, doctor, who is doing this, or have you? I mean, is MB Hospital and what you've done unique in that sense? Are there other hospitals across India also doing this now?
So we started it. Now a couple of people have started manufacturing this customized insole, but nobody is still manufacturing the designer footwear, which we collaborated with Central Leather Research Institute and Central Footwear Technical Institute. But the customized footwear, some footwear manufacturers have started manufacturing, but it's quite expensive. They're charging 30,000 rupees. We charge around 4,000 rupees. So it's quite expensive. And if you import it from Europe, it's about 30,000 rupees. So the problem in India, we should give them the footwear at a reasonable cost. So we have tried to keep the cost low at 4,000, 3,000 rupees instead of importing this footwear from Germany or Italy, which is the best people to make customized footwear. But it's very expensive if you try to import it.
So would you recommend to people would you recommend the 30,000, or would you say that the 4,000 that is now manufactured within this country indigenously is as good as anything that you can get?
Yeah, because we have published 2-3 papers on the insoles and all that in the Journal of the American Diabetes Association. We published it in peer-reviewed journals. And we showed that by using our footwear, you can reduce the pressures under the foot. And on long-term follow-up, you can prevent an amputation.
In fact, doctor, I'm just looking at it. 30 years career, you said 1991, started as a diabetologist. You've had 150 research publications in diabetic foot. It almost seems as if, for us from the outside, we should be proud that perhaps you are not just India, but the world specialist in this. So give us a sense of what kind of academic work has gone into this. How close have we reached to perfection now?
Yeah, so good question, Mr. Rajdeep. I think, as I said, if you want to improve, you have to reinvent the wheel. So you have to do new things. You can't preach what was taught 30 years ago or 100 years ago. So that's exactly what I did. When I entered practice in 1991, I found a lot of amputations happening. So I started researching the causes for amputation in India, started publishing the studies. So we found certain very important risk factors for developing an amputation among people with diabetes in India. We did it as a multi-centric study. We didn't do it only in our center. I involved people from different parts of the country. We had one study where we involved 31 diabetologists from across the country, from Uttar Pradesh, Madhya Pradesh, and everywhere. And we told them to send the data. Even today, we are doing such studies where we are involving all the doctors from other states to contribute data. And we also did a couple of studies with Germany and Tanzania and Bangladesh to compare the two populations, three populations, the African, the Caucasian, and the Indian. So we have published some studies looking at the risk factors for amputation in the Caucasian population in Germany, African population in Tanzania, and in Chennai. We have done studies within India and outside India too.
So could you sum up what those studies show? How does India compare, and even within India, are there marked differences between North and South?
Yeah, so the main point which came out in these research was in Indians, most of the amputations were happening in neuropathy. Whereas in Germany, there was a 50-50 of peripheral arterial disease where the blood flow to the arteries and to the legs is reduced due to aging. So they found, because patients in India with diabetes are younger than their counterparts in the European countries. So peripheral arterial disease, where the blood vessels get calcified, is much more common in the Western population than in the Indian population. So there were some differences on the reasons for developing amputation between the Western population and Indian population. Within India, we did not find much difference. We found across India, neuropathy and infections to be the major cause for amputation. In this 31 center study, which we did, which we published in the Journal of the Association of Physicians of India, we found that the most important reason for amputation across India from different states was in neuropathy and infection.
A question coming in, Dr. Viswanathan, for you from Mr. Sen Len. He says, my both feet, doctor, are constantly in pain. Doctor, you're saying diabetic neuropathy could be the problem, but can you suggest to me what should be the cure?
Yeah, so the neuropathy, what we are talking about, has two types. One is a painful neuropathy, and the next is painless. We have already talked about painless, where pain, which is God's gift to mankind, is taken away. Whereas the painful neuropathy is due to the small nerve fibers getting irritated by the high sugar levels. There are plenty of medications which are available. Gabapentin, pregabalin. These are not trade names. These are all generic names. I'm not talking about any trade names here. So gabapentin, pregabalin are all very effective. Duloxetine. So these are medications which are very useful to reduce the pain. But the tragedy is in the painless neuropathy. The patient is bothered more about the pain, but we doctors are more careful and more concerned about the painless neuropathy. But that leads to loss of sensation and amputation.
But this person saying my both feet constantly in pain, are you saying that through the processes that you've just explained, including the footwear, the person will eventually, will he live a painless life?
Yeah. So the pain due to neuropathy can be easily treated with pregabalin, gabapentin, and in 1 or 2 months you can.
Can you repeat that again, doctor?
Gabapentin and pregabalin are the generic names for these medicines, which are neuropathy. And in 1 month or 2 months, this pain disappears. And if you have good control of your diabetes, the pain will disappear. The pain is not only in about 5% of people, the pain will last beyond 2 months. But in majority, it will go off in 2 months if you use gabapentin or pregabalin.
You find though, doctor, that a lot of people are not aware still about this, that across this country, there are people who could be, suffering this pain for a long time and don't know what is the cause of it. Is that one of the reasons why BFoot International, in your role now as president, plus your role as at MB Hospital, that you need to spread awareness?
Yeah. So painful neuropathy, they will bear the pain for a week, but after that, they will seek medical help. But again, coming back to this neuropathy, the painless neuropathy, that's where people do not seek medical help because they are fine. And even if they get injured, they will not feel the pain and they will go on with the wound for, say, 2-3 weeks till it gets filled with pus and infection and there's a clear-cut amputation going to happen. So I think the pain is invariably due to diabetic neuropathy, though vitamin D deficiency, vitamin B12 deficiency are also important causes for painful neuropathy. And in India, many people are vegetarians and they suffer from vitamin B12 deficiency. Vitamin B12 is an important cause for neuropathy.
There's a question, doctor, from Arif. He wants to know, can you, doctor, give us 100% guarantee that between the medication, the footwear will ensure that I will live a pain-free life? Is there a guarantee? I mean, everyone nowadays, particularly in the times that we live in, wants to know whether they are safe, whether there are foolproof there is a foolproof treatment, doctor.
So neuropathy can only be prevented nicely. It is possible, studies have shown that you can prevent neuropathy by keeping
prevent it, or are you saying, doctor, that you can eliminate it?
Yeah, so we can prevent it. That is, the data is very strong. There are studies which have shown that neuropathy can be prevented by keeping the blood sugar control, which we assess by a test called HbA1c below 7. Now, once neuropathy sets in, right, it is irreversible in 95% of patients. You can only live with a feet which is not having sensation. So my request to doctors and the public is prevent a neuropathy at any cost, like saying prevent COVID at any cost, prevent neuropathy at any cost. And the best method of preventing neuropathy is to keep your diabetes under control. And today we have fantastic medicines in India and in the world for treating diabetes. We have patches which measure your sugar levels without blood testing. We can apply a patch onto the arm and it will monitor your sugar levels for 24 hours into 14 days without a drop of blood. So we have such fantastic innovations and gadgets in India. So the diabetes control has become so easy now, but we find that people are not keeping their diabetes under control in spite of so many innovations in science and technology being available right in our country.
Let me again get this clear for those watching, is that you're saying that you can prevent it with proper diabetic control, but you can't cure it once it sets in. Am I correct?
Exactly.
Then you can only minimize the pain, and if it is pain, or the damage that is to be done to your foot. So the real challenge is to prevent it even before it sets in.
Yes, exactly. You cannot treat, you can treat it, but you cannot cure it. Similarly, diabetes also, you can treat it. You can prevent diabetes, but you may not be able to cure your diabetes. So in 30 years, I have not seen anybody's diabetes getting cured. And the person saying, I'm off medicines, I'm taking everything I want. There are some people who are on the borderline who say, okay, I am now off medicine and all that. But full-fledged diabetics, in my opinion, personal opinion, diabetes is not curable. Diabetic neuropathy is not curable.
And for diabetic neuropathy, again, to get this clear, doctor, the first symptoms that emerge, which should be as a warning signal, which should take me to the doctor, are?
The burning sensation and feeling numbness in the field, numb If your feet feel numb and burning or pricking, any abnormal tingling also is an important symptom. If you feel anything funny happening in your feet, you should approach the doctor. That means you have neuropathy has set in. And this is a stage when prevention can happen and not after everything is lost,
Again, to be clear, it is not necessarily pain, doctor, that you may feel in the foot. It could be other sensations as well.
Yeah. So you could have, some people have tingling, as though, it's tingling sensation. Some people have numbness in their feet. They say my feet feels numb. So it is not just pain. It could be numbness, tingling, any abnormal sensation in the feet.
So there is a question here from Dr. Arup Sali asking, what is the prevalence of this? Let's say among diabetes, given the fact that we are the diabetes capital of the world, what percentage broadly, doctor, are suffering from neuropathy, diabetes, or from painless neuropathy, which to my mind seems even more difficult to detect?
Yeah. So neuropathy as a whole happens in about 20 to 30% of people if you're sitting in an outpatient clinic. If you're sitting in an outpatient clinic and seeing patients coming, and this was a study which we did in collaboration with the All India Institute of Medical Sciences in New Delhi, our center, and a government hospital in Madurai. We did a study which we published in Journal of API, and we found about 20 to 30% of people have neuropathy.
20 to 30%. So that's almost 1 in every 3, 1 in every 4.
Yeah, about 30% of people have some degree of neuropathy if you test them in the outpatient department.
So that in sheer numbers, doctor, that's a huge number. When you look at India's total diabetic population, and if you tell me that 1 in 3 to 1 in 4 have some traces of diabetic neuropathy, then you're talking about a very, very large population.
Yeah. Dr. Vishnupriya, would you agree with me that a very high number of people whom you see in the outpatient clinic have neuropathy?
Absolutely, sir.
And what is the first thing you tell them, doctor, when they first come to you and say, look, this is what happened, you detect the diabetic neuropathy, what's the first thing you do, doctor?
So the first thing we do is to control the diabetes. The second thing we do is we teach them how to take care of their feet. We teach them muscle exercises in our hospitals in Bangalore and in Chennai. We teach them how to exercise their muscles and teach them simple exercises. You can keep a sheet of paper between your toes and grip it. So that's a good exercise for improving the muscle power in your feet. You can keep a turkey towel in between your toes and grip it. So it will help to develop the muscle power. We teach them that. We teach them on foot care. Cutting the nails is very important. The recommended method to cut nails in somebody who's got neuropathy is to use a nail filer regularly and not use a scissor or a blade or even a nail cutter, because a nail cutter sometimes can cut the skin. I have had a patient who had a below knee amputation after cutting his nails with a nail cutter some years ago.
Fascinating.
So, because he could not see, so he cut his skin along with the nail. And people have a little paunch, they can't sit. So I think what we do is we teach basic pedicure for our people. We teach them, many people don't know how to use a nail filer. It's not the nail filer which is there along with the nail cutter. You get separate nail filers, the long ones. And we teach them how to use a pumice stone, because many Indians have a crack in their heels because they walk barefoot. So we teach them how to use a pumice stone, which is a small stone, to rub and remove the fissures in the heel, So simple, these problems look very simple, but they are very important. We teach them. So people should understand that these are simple matters, but they should understand it and learn it.
I'm getting a few questions, doctor, quite a few questions. Rohini from Chennai wants to know. There are those who say, I don't know what are the basis that she's saying this, but she said there are those who say we are facing diabetic health issues due to the side effects of the diabetic medicine than the diabetes itself. Is this true?
So, yeah, everything has got side effects. So, if you use steroids for COVID, you can get fungal infection. So, everything has got a side effect. But that is where we need the cooperation of the patient. If they are controlled with their diet and exercise, then we can reduce the medication. I'm sure Vishnu Priya will agree with me that many people are not controlled with their diet and exercise. And therefore, they have to depend on higher dose of medicine. And a higher dose of insulin or medicine will definitely have side effects. Would you agree, Vishnu Priya, that if they have a better control of diet and exercise, they can minimize the tablets?
Definitely, sir.
Dr. Vishnu Priya, what is the kind of exercise that you recommend for diabetic patients?
They can do walking, they can do yoga. So basically, we want them to do 3 types of exercises. One is an aerobic activity, where it could be walking, cycling, treadmill, or aerobics itself. And then they need to do some, for flexibility, they can do yoga at least once or twice a week. And then some stretches for resistance training, either weights or stretches. So if a diabetic individual can do these 3 types of exercises, they can have a great quality of life.
So, that's reassuring in a way that it's not as if, you can't live a better quality of life. And I'm going to come to that in a moment. But there's a question, Dr. Viswanathan, for you from Sandhya from Pune. Interesting question. She says, each and every country appears to have a different diabetes threshold value. What is India's value, Dr. Viswanathan?
So that's why we depend upon the World Health Organization. So the World Health Organization has given certain criteria for the glycemic threshold, as we call it. So they have said, the WHO, and that's what we follow, if your fasting blood sugar should be 110 to 120. If you're an elderly person, it can go up to 130. If you're 80 plus. Similarly, the after eating blood sugar should be 160 to 180. But in an elderly person who's 80 years old, we can stretch it up to 200 milligrams. Similarly, the last one, HbA1c. For a youngster of 40 years old, we keep a target of 6.5%. In a little
6.5.
elderly, 6.5. But in a little elderly person who's 60 years old, we'll say 7. And now the WHO says if you're 80 years, you can keep it up to 8%. So you don't have to control the diabetes very intensively in an elderly, very elderly person who is prone for low sugar. An 80-year-old man, if he gets into frequent low sugar, it can affect his brain and his thinking and sensorium and his remembrance and so on.
Because during COVID, we've seen, how much age group and the demographics matter, particularly also comorbidities matter. Now, in diabetes and diabetic neuropathy in particular, is there a certain age group which is more susceptible? Are you more susceptible if you have certain comorbidities?
Yeah, so the age group which affects neuropathy is above 40, because we assume that diabetes starts at the age of 30, 35. This is the mean age at which most of the Indians get diabetes. And if they have diabetes for 10 years, neuropathy sets. So around 45 to 50, when they are age 45 to 50, is the age when neuropathy sets in, after about 10 years of diabetes.
So, in a way, are you, who is more susceptible in a way to the neuron? Let's get that again clear. Are you saying that once you cross 40, you could be as susceptible as someone who is 60?
Yeah, so as the duration of diabetes increases, so supposing somebody got diabetes at the age of 30, by the age 40, he is already will have neuropathy. Whereas if he got diabetes at the age of 55, then by the age of 65, he should have neuropathy. So it's rather than the age of the patient, it's the
Right.
age of diabetes, the duration of diabetes, which is more important. It's a linear increase. As your duration increases,
Right.
your prevalence of neuropathy increases.
Doctor, I have a question from John Devashayam. He says, "Hi, Doc. I have been suffering from neuropathy for the last 2 years. Though my sugar levels are well under control, I am on the medications you mentioned, but still I have no relief. Why? What do I do now?"
Yeah, so there is, as I told you, about 10% of people who do not respond to the conventional medicines for neuropathy, the pregabalin, gabapentin I told you. So they have to be treated little differently. And we need to really examine and see the other causes for neuropathy. As I told you, vitamin D deficiency, vitamin B12 deficiency is also to be looked into. So I think we'll have to do some more investigations for this gentleman to see whether there's any other cause for neuropathy. Thyroid disease can also produce neuropathy. So we need to check out if this person really has diabetic neuropathy or some other neuropathy.
There's another doctor wants to know what do you prescribe as the most modern treatment that we have at the moment for diabetes, diabetic neuropathy? Is there, I mean, how, I'm presuming that with every year, with all the research that you and others are doing, you're coming up with new and new solutions. What is the most modern solution?
The latest medicine for diabetes, which is making sensation all over the world, is a drug called SGLT2 inhibitor. SGLT2 inhibitor.
Can you just repeat that, doctor?
No, I'll give you the generic name. Dapagliflozin, empagliflozin. They're called gliflozins. They're making waves, sensation all over the world because these drugs, in addition to controlling diabetes, it prevents heart failure, it prevents kidney damage, and it helps to improve the complications. So these drugs are now favored, and these are available in India, made in India. Many companies have started making this product in India. It's affordable. It's affordable to the common man. So the latest medicine, oral medicine, is gliflozins. Insulin, of course, we have plenty of insulins across different ranges, which a doctor can help out with the patient, so.
In general, doctor, is this, and this is my own question, genetics, how important is that, the fact that either of your parents, especially your mother, may be a diabetic, does that make you more prone, even with diabetic neurology? Does it pass from generations, doctor?
Yeah. So about diabetes, I can tell you, Mr. Rajdeep, the classic example is what my father used to say in 1940s. When you are born with both parents diabetes, the gun is loaded. But what pulls the trigger is the environmental factors. You putting on weight, not doing exercise, a sedentary lifestyle will pull the trigger. So genetics is the bullets inside a gun, And what makes the bullets come out or pulling the trigger is the environmental factors. So this is what my father, Professor M. Viswanathan, said some 50 years ago. So I think for neuropathy, I go one step ahead and say that there is no genetics here. It is 100% environmental factors. There's no genetics for neuropathy. Nobody has found a gene for neuropathy as yet. Diabetes, they have found some genes, but for neuropathy, for foot complication, there's no gene. You take control of your diabetes, keep your diabetes under control, you can prevent neuropathy, you can prevent an amputation. The more care you give, the better for you.
Since you mentioned your father, I want to understand from his generation in the 40s, 50s to what you've done. Must be a remarkable evolution over time, but he must have been a pioneer. Was he your inspiration?
He was 100% my inspiration, Mr. Rajdeep. Even till today, I am what I am because of him. And he was a role model to me, still a role model to me. So
I have a question coming in from Anita Panikar from the US. She says, "Doctor, in the introductory remarks, you mentioned that Indians have less muscle mass and more fat inside, which makes them more susceptible to diabetes. So exercise regimen and reducing fat through diet and again through aerobic exercise, would you say that's the most important way or one important way to prevent diabetes, particularly in people of Indian origin?"
Exactly. So what Dr. Vishnupriya said was, you need to improve your muscle mass. So you have to lift a 2 kilogram weights And that is a good way. And there is something called a Terra band where you can pull, and so that is improving your muscles. So if you improve your muscles, if you increase your muscles, the insulin resistance, the blood sugar is sucked into the muscles, and blood sugar will not remain in the bloodstream. So improving your muscle mass, your glucose, which is floating around in the blood, will be pulled into the muscles, and your blood sugar will come down. So that's the importance of doing the exercise. And she also talked about aerobic exercise, so like swimming and walking, cycling. So that will also improve. So aerobic exercise, strength training, and yoga she was talking about. So these three things coupled with reduced carbohydrates. I'm not saying don't take carbohydrate, lessen your carbohydrate, reduce your carbohydrate, and avoid all the unhealthy carbohydrates. We eat a lot of snacks which are carbohydrates that you should avoid. But for your main meal, you can take carbohydrate. But avoid all the snacks which are carbohydrate snacks.
So avoid all the chips and the chana and everything else that we have time and again. India in particular, doctor, as you know, we are very susceptible to all this. It's all around us. You're advising restraint at least. Doctor, many people who develop the diabetic foot ulcer keep getting a recurrence, they say, of the ulcer later on. This ultimately, does it lead to amputation of the toes? Can you just elaborate?
Yeah, it's very sad. So Rajdeep, last 30 years I've been seeing this. People whose one toe is removed, they come back after 6 months for another toe to be removed. Number one. Number two, this week I had 2 people, and today I have one person admitted from Pune, whose one leg is amputated, and the other leg is going to be amputated because they have developed gangrene. So it's very sad that somebody has to be amputated on both sides, and he has to live with both the legs being absent. It's a disaster. It's something which I want to avoid, and DFoot definitely doesn't want this to happen to anyone in the world. That cutting off somebody's leg once and then cutting off the other leg, cutting one toe now and cutting off one toe later. We want to prevent amputation. So that is the main mission statement of DFoot, which is based in Belgium, is to prevent lower limb amputations due to diabetes worldwide. So that's what we're struggling for. And as the president for the next 2 years, I'm going to take it up as my challenge and as my main achievement of trying to improve the foot care in our 7 regions of the world, the SACA, which is South America, Central America, North America, and Caribbean, Egypt, Africa, Western Pacific. So this is what I've already started conversing with the world, the diabetic foot experts from all these countries. And
I am told, doctor, over the last 30 years, you've trained more than 2,000 doctors already in India for this process of prevention of lower limb amputations. In a way, therefore, has the process started? What if I'm a doctor in a small town? I don't have the access that MB Hospital has in Chennai. Are you spreading this message? Are you evangelizing more and more people to embrace what you're saying, the ways to prevent lower limb amputation?
Yeah. It's not the effort of one hospital which is going to matter. So we trained 2,000 doctors from India, Nepal, Bangladesh, and Sri Lanka. And we did a program called Step by Step program in 2004, where doctors and a nurse from Bangladesh, Nepal, Sri Lanka, and India took part. And I was one of them. I was one of the people who drew up this program. After this, the Step by Step went to Africa, to West Indies and Pakistan and other countries. So I think the most important message is for training more doctors. And I'm very happy that I've been able to spread this message across the country. And now I have an opportunity to spread this message to different other parts of the world too.
I have a question from Shri Kumar, who's on chat box. And Shri Kumar wants has a question for you, doctor. I'm living in the US with telemedicine there, where can I access all the information about D Food? Is there a site, a website, a space where you can?
So we have our website, which is called www.d-foot.org. www.d-foot.
D lower dash or a
No,
hyphen?
it's a
Lower
not
dash.
not a lower dash.
Hyphen.
Not the underscore. Yeah, it is a hyphen. Yeah. So
So D-foot.
.org.
D-hyphen. So is there a lot of research, therefore, which has been shared, doctor, across the world? A lot of what you're saying now, is this now becoming common practice, virtually sort of trying to set common practice and procedures to do what you said is your mission statement, to ensure that the minimum number of people across the world do not have to go through a lower limb amputation? Am I correct?
Yeah. So this website has got information, but it doesn't have all the information which the person is asking for. But we can search for information in the internet and get any information. In our website, we have some information about what's happening in different parts of the world, and we are updating it every month. So you can get the information from anybody, from any source you want. So
just a few minutes left, doctor. We've been going on for about 50 minutes. So, but there are questions. Nandini wants to know, doctor, should I be taking insulin without my doctor's advice?
So insulin, by the way, Mr. Rajdeep, this is the 100th year of the discovery of insulin.
That's right.
2021. So I think it's a miracle drug. In some people, you just give insulin and spontaneously the next day you see them different. So it's a miracle drug. So, but having said that, it has to be used judiciously and under supervision of a doctor. You cannot start insulin on your own. You will have to consult your doctor.
But, do you fear at times that people will be tempted to, take it, because everybody wants to get well soon, doctor? But Dr. Suganya has a question. She says, we heard that one of the reasons, doctor, for your success is the multidisciplinary team that you built. Tell us about your team at the hospital.
Yeah, so I think the diabetic foot management, when somebody comes in with a foot ulcer, an ulcer in the foot, blood circulation will be less. You need to offload that area. You need to reduce the pressure in that area. So you need a team to work. So that's what I did in 1991. I built a team of an orthopedic surgeon, a podiatrist, a cobblers. They are very important. We could call them cobblers, but in abroad they're called footwear technicians. So they make footwear which reduces the pressure in that area. Only then it will heal. So I think the success story of any diabetic foot service in the world is a team. Without a team, a diabetologist or a surgeon alone cannot achieve anything. You need to have a diabetologist who will control diabetes. We need a surgeon, we need a podiatrist, we need footwear PEEP technicians who will reduce the pressure. The blood flow is less, we need a vascular surgeon who will put a balloon angioplasty into the feet, Bypasses are not done in the feet now, but we do balloon angioplasty. So I think what I've done in the last 30 years is slowly built a team from a zero, no team to a full-fledged team. So that's the real success story.
So are these footwear technicians, as you call them, or as they call them abroad, we call them cobblers, are they located within the hospital, or do you outsource it?
No, we have employed them. They are in our employment and they take the measurement. Because I was telling you about 30% need customized insole. So I think they see the person with diabetes with an ulcer. They mark the place where there is an ulcer and we have about 8 footwear technicians with modern machines to make footwear. So we make sandals, we make shoes, we make insoles and give it to them. Wow. And which the patient can wear and walk about. Because everybody wants to walk and everybody wants fashionable footwear. nobody wants to wear an ugly footwear and walk about to office. So,
Doctor, it's remarkable what you've achieved. As we come to the end, I want you to give one final message. There are lots of people out there who will be inspired by what you've said, who've also been educated in a way and thereby empowered and enlightened by all that you've said. I must confess, I had so little knowledge about diabetic neuropathy, and I think that's part of the problem. And therefore, you deserve a huge applause for using DFoot International to spread this message. Do you have a final message, Doctor?
so that my final message, Mr. Rajdeep, is please control your diabetes. It's easy. It's easily treatable and it's easily controllable. 2 is don't ignore your feet. You give as much importance to your feet as you would give your face. We give so much importance to our face, but we don't bother about our feet. So give as much importance which you would give your face to your feet, and then things become very easy. So feet and diabetes, don't forget that connection.
It's wonderful how you've explained it. I think what you've done is demystified it. I think that's very important, and I think more and more doctors need to do that. Demystify medicine to make it accessible in a way for a common man. I'm going to ask you one final question, Doctor, that's coming from Narayani Gopinath. She says, I am a diabetic for over 22 years. I'm getting bunions on my feet like corns. Is this because of my diabetes? And if so, how to reduce it?
Yeah, if it is happening on the sole, it is due to pressure. If it is happening on the side, on your malleoli, as we call it, it's because of pressure, because you're sitting cross-legged. So don't sit cross-legged in the floor and so on. And if you have the bunions or the callus corns on the sole, is due to pressure. If it is due to the sides, it's because your footwear is tight. So most of the bunions and calluses are due to pressure points, either by the footwear or by sitting cross-legged or by walking barefoot. Now, there are many other reasons, so that you should consult a doctor.
You're saying it need not necessarily be diabetes, right?
Yeah, need not be necessarily diabetes, no.
Okay. Again, you help to demystify a lot of what, I think people struggle with. Doctor, it's been a pleasure and honor speaking to you. And I hope that the work that you're going to take forward between 2021 and 23 as the president of DFoot International goes across India. I hope that many people will access this video and thereby empower themselves. Maybe we'll have to put Hindi translations because there are people wanting to know, what you said in Hindi, and I think that's possible in post-production. But I do hope that many people listen to you, follow your advice, and that DFoot International goes from strength to strength under your leadership.
And Mr. Rajdeep, it's been a privilege to talk to you. You are known all over the country, and we heard that you have 9 million Twitter followers. So I think you are a person to whom people listen to. So, so to talk to you, it's been a real pleasure and a privilege for me. And I think with you doing asking the questions, I think the reach will be much more than somebody else asking me a question. So thank you very much for your time, Mr. Rajdeep, and I enjoyed every minute of it.
Thank you very much to you, to MB Hospital, all the very best, and to Saima for organizing this, and Dr. Vishnu Priya for also participating. Thank you all very much.
Thank you.
Thank you, Dr. Viswanathan.
Thank you, Rajdeep. Rajdeep, thank you.
Thank you.
Thanks, Rajdeep and Dr. Vijay. Thank you so much. I think it was a very enlightening discussion, and we had viewership right from all across India and even from USA. Now I'd like to invite our president, the president of SAIMA, Mr. Shabin Sarvottam, to propose a vote of thanks.
Thank you, Shri.
Thank you, Doctor. Before I go in for the vote of thanks, I'd like to just say that Dr. Viswanathan's dream was not to give this talk, but to make everybody aware that what the food plays and how important it is to be in a person's body. I mean, every part of the body is quite important but I never knew about what Dr. Viswanathan has enlightened us today. So I think with the blessings of your father, Dr. Viswanathan, I think today's session was an absolute eye-opener for most of us, even for me also. And I'm going to start telling everybody, that be extra careful in what you do when you consume too much sugar and when it's really not the right thing. Right? So I like this. Take this opportunity to just thank Dr. Viswanathan for this beautiful oration what you've given today. Dr. Vishnupriya for having enlightened us with a few of the tips what she's given us, and plus for even introducing the person behind the entire episode. Of course, Rajdeep Sardesai, we don't need to really talk about. He has really put it across in a very systematic way. He's as Dr. Viswanathan said that his one tweet or his one information covers about 9 million people. So that is the key for today's evening. And I think the word of Dr. Vijay will really take places. I even like to thank Ms. Raji and all the team members from MB Hospital to have put this entire evening across. Without the physical today, it's all about virtual world. So we had the Zoom team, assisted by Mr. Shankar, who correlated this whole thing of today evening. We had a marketing team expert, Ms. Sarita, who helped us in taking this across to the various parts of India as well as to the world. As Dr. Ajit said, we had even people from the US and other places also coming in. Of course, my co-founder members from SIMA, Mr. Arvind from Stage 3, the CEO of Aditya Hotel, where we are stationed ourselves in conducting this whole evening of today's talk, and Mr. Surinder, who's Mr. Rajiv Sardesai's office secretary. I think he's been correlating us with Dr. Rajiv in terms of getting him on time and getting the connection on time, everything falling in place. Not to forget the media. Of course, they play a vital role in, apart from the social media, they also play a vital role in taking this to a different level and informing the world what the D-Food is all about. Right? So thank you so much, Doctor. Thank you once more to you and your entire team for a wonderful evening session.
I would like to thank Dr. Ajit and Sir Shabin and your entire team at SIMA for this wonderful program which we arranged. And thank you, Ajit, for all your help and support.
Thank you, Doctor. Thank you so much. It's been a wonderful evening for us.
Thank you.
Thanks, Doc. Thank you.